PCBH Special Interest Group. This is Polly Kurtz, and I'm going to turn it over to Chris Hunter in just a minute, but before I do, I just want to go through some housekeeping. I am right now in the process of unmuting each of you, and so you're going to be hearing some background noise. If you will go to your taskbar, which is on the right-hand side of your page, there's a little green microphone at the top. If you could mute yourself unless you're talking, it'll help us cut down on the background noise. Everybody good to go? Let's see. A few more people are joining, so I'm in the process of unmuting. Again, one last time, if you'll mute yourself, everybody should be unmuted from an administrative standpoint, and then if you want to chime in and talk, you can just click the little green button off and on and unmute yourself. Okay, Chris, all yours.
Okay, hi everybody, this is Chris Hunter. Jeff Ryder couldn't be with us today. Let's just start the agenda item. This is just a reminder, anybody who wants to post any kind of message directly to the civic listserv, please do so. That's the best way to get directly in contact with people who are probably going to be most likely to respond or be interested in things as they relate to a PCBH model of service delivery. We've split the agenda into two different pieces in terms of ongoing business and some new business. So let's start with the ongoing business. Do we have I believe we have an update from the webinar work group. Randy, are you on the line?
Yep, I'm here.
Great. Take it away.
So briefly, we are moving along is the update. We've secured a few presenters for the first set of webinars, and we're working on the details of those things, and we're continuing to work on stuff.
Okay, and I guess anybody that would have any part of the webinar group can certainly go ahead and contact Robin or yourself. But it sounds like you guys have a pretty decent number of folks, and that you're kind of chugging along and are working on some short-term deliverables right now, yeah?
Yep. Mm-hmm.
Okay. Anybody have any questions for the for Randy and the webinar work group?
Yeah. Hey, Randy, this is Polly Kurtz, and we were just hi. We're just scheduling out the webinars, and I know you and I had kind of touched base. Do you guys think you'll be ready to go by October, November?
I know that we are meeting as a group again next week, so we'll be able to touch base about this. But I think you were in touch with another member of the group about CE credits.
Yes. Right. And
probably.
So what I will need from a CE credit perspective is just I'll have to have all of the information required, which we don't need to go into that now, about a month before the webinar. So it's helpful for us in terms of scheduling things out. We usually work like 3 or 4 months in advance. So I'm at the point now where I have to commit to those months in the fall, and I'd really it would be great if we could. I would love to do this series, but if you guys aren't ready, I just need to know one way or the other.
Okay, I will communicate to the group.
Perfect. Thank you.
Thanks, Randy. Thanks, Polly.
Sure.
We don't have any update on the social outing committee at this point. Stand by. We'll probably have more in August and September. And so, David, I think I see you as being signed in. So, can you give us an update on the toolkit committee?
Absolutely. And can you hear me?
Yes.
Okay. Good. Good. Not too much to update from last time. We're just plugging away, trying to just gather as much information as possible on different sections that we talked about last time. The one question that we did come up, and we kind of have, I think, a good understanding, but we just wanted to throw it out to the, on the phone call to see what everybody thought, was who we want to specifically gear the toolkit for. Our initial thought was everybody and anybody. You know, we definitely want there to be information for people in this model, such as handouts and research and references and things like that. But we also wanted to have information for students and for just anybody that's interested in the PCBH model to have something that's valuable to them. But we wanted to make sure just with everybody what they thought about, is there a specific sect or population or I don't know, people that we should be gearing the toolkit more for, or should it just be kind of an all that we're trying to do?
So I'm curious, what is the what's the general consensus from your work group members? What do they think?
Well, we were having this conversation about email today, and the general consensus was let's try to have it be all-inclusive. Try to have as much information as possible for people from all backgrounds, whether it be medical, whether it be psychology, whatever it is, try to have something that is useful for them. We definitely want to have, we're having a training portion of the toolkit, which will obviously be geared to not only BHCs that are there, but medical residents, graduate students, undergrad students as well. So our general thought process was let's try to be as all-inclusive as possible, but we wanted to see what everybody else thought too.
Right, and well, I'll tell you my thoughts on that is that sounds like it's right on target. I mean, given what CFHA is all about and the diversity of professionals that are part of CFHA and breadth of where people are in their careers, I mean, that sounds like right on target. So it would really, really be able to, I think, work well for anybody who's a member for CFHA. But for those of you that are online, do you agree with that, disagree with that? Okay, hearing no comments. David, do you have any other things to add?
The only thing that I would add, and obviously, Chris, we've been talking about this through email, is just for everybody who's on these committees, and I think this would probably be more relevant for the FAQ committee as well, is that when we're starting to pull materials and things that we want to be included on the website, to just be mindful of copyrights and just make sure that we're going through the proper channels and getting permission to put things up on the SIG webpage. We don't want to run into any problems with that. So I guess try to put the work in early, trying to go through, you know, getting copyrights from APA and different things to be able to list certain handouts and stuff. So just people, just be mindful of if you are going to try to put something or use something, that we do have the appropriate permission and approval for that.
Right, and David and I had emails back and forth that I had to chuckle at after a little bit, but it's, I mean, pretty much anything out there that's published on a website. I mean, I think we need to make sure, you know, if we're going to put it on CFHA's website or a link to it, we want to make sure that we get permission for, make sure that it's okay with whoever owns the copyright, that people can download that, because just because it initially doesn't appear, like if we put a link to another website, if it doesn't appear that it's copyrighted, it still may be copyrighted, and we don't want to, you know, lead our members to believe that this is just free access material when it's really not. And my experience has been that most people that own copyright on stuff like this are generally happy to have links to their material because it's free advertising for them, and it has the potential to create business, especially if it's links to documents that are, you know, part of a larger set of books or a series of things. So thanks for that.
Yep, and that's all from, I think, from the toolkit.
Okay. So Suzanne, are you on?
I am. Can you hear me?
I can.
Great. All right. Well, hello, everybody, and greetings from the FAQ work group. So thanks, David, for that. And because I actually had not thought about the copyright issue. So let me tell you what we're thinking about. We've met once. We basically just brainstormed a group of issues that we thought people would be asking questions about. I'm also trying to keep, I'm sure other people are too, keep an eye on the listserv to see what kinds of questions come up. And the plan was to kind of work backwards to take a topic, say, you know, model descriptions or something, and then to come up with a question, state a question that we think might fit that, briefly answer the question, and then refer to any existing website links that, and then accompany that referral to the link with a brief kind of summary or abstract in the sense of what the end user is going to find at the link. Mm-hmm. So I guess it had not occurred to me that I just assumed that people wanted you to link to their pages, and it had not occurred to me that you have to ask permission. So that's good to know.
I think you can certainly link to people's web pages, but if we're linking to any particular document on that page, you know, if it's just a web page in general, I think that's fine. But if we're linking people specifically to a document they can download, I think that's where there's the potential for some problems. But if you guys are just linking to the website, oh, that should be fine, right?
Yeah. So, yeah, sorry about that. Yes. So my understanding, guys, is that if we link to a website or a web page with just general information, we don't need to have permission for that. But if you link to like a downloadable PDF of a document, that's when we need to get permissions. Does that make sense?
It kind of does, but I'm thinking about something like this. CIHS has all those billing worksheets, state by state. So you could link to, you know, the billing worksheets. And does that mean that if I'm the end user and I download the PDF for the state of Pennsylvania that I'm personally violating a copyright law that I might not even know I'm doing?
Are those documents copyrighted?
I don't know. That's, yeah.
Yeah, if the documents aren't copyrighted, it's not a problem. And most of those documents should say on them if they are copyrighted. So.
Okay. So that's where we're at. And then the other question that's emerged just in between, and so on June 9th, we're going to meet again and see how we've done with starting to collect resources and questions. The other question that emerged is whether this is part of the toolkit, a separate thing for the toolkit. You know, I don't think it has to be one or the other. I think they can stand as separate committees and be merged into one. But that was the issue that came up between meetings. But I'd say we're doing pretty well.
Any thoughts, comments, or questions for Suzanne?
Chris, it looks like Leslie has some comments, and I've been trying to unmute her, but have had a little bit of difficulty with that. So I'm just going to read her comments, I think. Hold on just a minute. I can figure out how to do this. Basically, what she says is that there are actual rules to regulate copyright versus public access information, which is found online. In addition, there should be copyright on the document itself. If there is not copyright on the documents, then it is not a problem. Also, those documents regarding billing practices per state are out of date extremely. For most states, changed legislation in the last 4 years. Yeah, so
that to me suggests that if we're going to link to any kind of billing documents, we might want to make sure that, in fact, those are the latest and greatest documents. We're not leading people to things that won't be even used to them. And it also should be really clear if something's copyrighted, because it usually says copyrighted on it. I think I've noted the American Psychological Association these days on their PDFs is making it even really more bold than it was before. So it's really clear that it's copyrighted and you need permission to reproduce it. So I don't know whether they're going to go after copyright violators. Thoughts? Any comments?
I think we've been playing it safe.
Say again?
I think we've been playing it safe by contacting the copyright or the publishers directly, which for me sounds like the best bet instead of assuming that the same rules apply across the board.
Yeah, I think at the end of the day, if it says copyright on it, I think CFHA and Polly has already confirmed this. If it says copyright on it, then we whoever owns the copyright and get them to expressly say that yes, it's fine for us to put this stuff on our website or list a link directly to it, and our people can download it without any problem.
So do we need that in writing, Chris? And then that's something that Polly would be the keeper of, just like an email or something that we would forward to somebody?
Yes, yes, absolutely. Suzanne, that's kind of what we just have a file folder of anything like that we would have on our website where we've needed permissions. So we would just keep that.
Any other comments? Okay. So Robin, I see that you are signed in as well. Do you want to speak just a little bit on the outreach branding piece? Robin, are you there? We can't hear you. Ooh, a question mark. What's that mean, Polly? So I think Robin's trying to communicate with us, but there's a little question mark by her attendee name. So she has agreed to chair this work group. That there are some ideas that have been thrown around in terms of how we can have some recognition at the CFHA conference in terms of ribbons, what those ribbons might look like. And they would be in charge of looking at what kind of logos that we might want to have for the STIG, or creating PowerPoint templates when we are having our webinars. There was also some talk about getting a list of presentations that have been accepted by our SIG members that we think other SIG members might be interested in, and kind of distributing that list to our SIG listserv prior, instead of having folks having to go through the conference brochure and pick those out. So more to come on that. Robin? Okay. Robin, email either myself or Polly and let us know what kind of problems that you've run into, and we'll see if we can figure those out for our next meeting, okay?
And Chris, this is David. Should we email Robin to get that list going of presentations at CFHA?
I don't want to speak for her. So
okay.
myself, yes, but since she's graciously agreed to chair this work group, my understanding that if you have had that if you submitted a presentation and it has been accepted, you should have been contacted that it has either been accepted or not. So I would.
And I just got an email from Robin actually right now that said that's fine. So.
Okay. So yes. if you want your presentation put on the list that we'll specifically send out to our PCBH listserv, go ahead and send that to Robin, and her email is right there on the agenda.
And hey, Chris, this is Polly. So we've learned that Robin doesn't have a mic, which is part of what's happened with that. So she'll work with that next time. And I have unmuted everyone. As a reminder, if you would be willing to mute yourself using the green microphone at the right, that'll keep down our background noise. Great. I think that solved it. Okay, so I think I have everyone unmuted at this point. The other thing that Robin said is she will send an updated email to all to request participation. So anyone who's interested in that, she'll send an email out.
Fantastic. So next item on ongoing business, and we thought this is just important to kind of bring up every time. Does anybody have any opportunities for collaboration with others that they'd like to throw out there or discuss? Projects you are doing that you want to do that you've conceptually thought of? Okay. Hearing nothing, we will go on.
Oh, Chris, you know what? This is David again. I could jump in real quick. Just a reminder, we talked about this the past couple of times, but if anybody is interested in partnering, Bridget Beach, Melissa Baker is a part of this a little bit as well. We're trying to send out the survey link to medical providers that could be MDs, DOs, NPs, PAs, that is looking at their stress levels at work, related to work-related kind of issues, and then also doing a measure of psychological flexibility, which is from acceptance and commitment therapy. And we're looking at data, and we'll also try to gain some psychometric properties of the measurements that we're doing. So if anybody's interested in that, they can contact me, they can contact Bridget or Melissa, and we'd be more than happy to collaborate with anybody on that. The survey is already done, the link's already made, so it's pretty simple, a pretty simple process.
So is the primary goal to start to develop a measure and to start to set its psychometric properties?
Well, we're using Patty's measure that from the real change in primary care, so the PCP stress checklist, and then we're also using the PCP AAQ that Patty presented in that book as well. And then we're just using the AAQ2, which is just a general measure of psychological flexibility, which is the psychometric properties for that are well established. But the other two, we're really trying to establish that, and then we're also trying to see is flexibility related to work-related stress, which from our initial data, yes, it is, which isn't surprising, but we would want to just keep collecting data on this and keep this project going as long as possible, really. So again, if anybody's interested, please let us know.
And is one of the goals to publish the information in a journal?
Absolutely.
Okay. So anybody that has any interest in that, please go ahead and contact David. And I do not see your email here on the agenda.
If anybody needs it, they can, on the little toolbar on the right side with it, if you hover over my name, my email comes up with that.
There you go. All right. Anybody else? Opportunities for collaboration? Okay. So that leads us to new business. Are there other areas that you would like to see us address during these meetings? What are we missing? Okay.
How about research? Or is that, I came a little late today, so.
Rusty, is that you?
Yeah, it's me, sorry.
So tell me more about that. So research, what about research do you think would be important for this SIG to put as an agenda item or address?
Well, I guess I'm I'm sort of, kind of pushing the general theme that that in CFHA at large, we ought to be engaged in ongoing practice-based research that demonstrates the effectiveness, value, ways to improve what we do, continuous quality improvement of whatever form of collaborative care that we're doing. And so I just raised the question about whether or not this SIG specifically should be involved in that or wants to be involved in that, whether the people in the SIG want to be involved in that related to this particular model's effectiveness and efficiency, et cetera.
So if we were to have an ongoing business item, I'm just throwing this out as a off the top of my head thing, one of the things that we could do to make sure we have a placeholder is we might have the CFHA Research Committee, if they're willing, to come and talk about what are some of the things that they have that are going on, because they meet monthly and they have a variety of different projects they're pursuing. And that way research is automatically talked about at this SIG, and it allows our members, if there are things that are specifically related to a PCBH model of service delivery or some iteration of that, to kind of join with the research committee. It also makes sure that we have an opportunity that as the research committee is talking about what they're doing, it could also generate other ideas for our SIG that could lead to a discussion or not a discussion for that particular month. Is that along the lines of what you were looking for, or something?
Yeah, all good. I mean, I think it takes an army to do research, and or at least it takes a group of people who are sort of very interested in a particular idea, and I think that we're all still in the process of sort of building models and believing in different models or trying to understand whether different models are producing good effects or not. And I think that, as I said, CFHA written broadly, we ought to all be sort of, kind of thinking about this. And
so Rusty, do you
those
think
connections are good ones.
Again, I'm just throwing this out there as just a discussion item. Along those lines, do you think we should have in addition to the CFHA research committee that looks at kind of any kind of potential program evaluation, quality improvement, and research on any kind of model, do you think there'd be any value in having a specific research committee or research work group for this SIG? Or is that getting too much in the weeds?
Well, it might get too overstructured. I mean, I don't know how many, I haven't sort of been keeping count of the number of sort of kind of work groups the SIG has generated, but, and it depends on the volume of the number of troops, one has, right, about how often you subdivide and subdivide and subdivide. So I think that this SIG sort of represents a model that is I would say, a very positively and numerically represented model in collaborative care. So if I were trying to think about ways to sort of investigate or document the effectiveness, efficiency, cost effectiveness, whatever, of collaborative care, which I think we should all still be quite committed to, this group would be, I would want this group involved. I would want this group represented. So if we were to do some sort of practice-based hoo-ha on treatment of depression, one focus of analysis might be one model versus another model. Mm-hmm. I mean, that just, potentially. And so that's why I think that the things that you just suggested about how to connect with the research committee and stuff like that should be important, or would be important, and it would be important, at least at the SIG's choosing, to periodically kind of make this a focus of discussion by everybody on the call. I mean, unless there's crickets. If there's crickets, then
sure,
go on to item 2.
Sure. So we have about 25 people, it looks like, signed in. I'd like to hear others' thoughts or comments on what we've been discussing.
This is David, and again, I couldn't agree more with that. I think it would be something that would be extremely useful to have. Yeah, I don't know if we need a committee. Again, the committees might start stretching, but just to have this continuous discussion about this. Now, Bridget and I, and also Melissa, we're going to be presenting some of our research that we've done at ACBS in 2 weeks on ACT and the PCBH model with anxiety, with weight management, and also with hypertension. It would be cool just to have this kind of ongoing discussion, and we're going to try to present this idea about looking at research in the PCBH model from a three-pronged kind of approach. One's the clinical interventions, one's kind of training residents and medical providers, and then also the last one is making sure that we're actually making medical providers' jobs easier, as well as the agency's jobs easier with that. So we're trying. The one thing that again, just to tell you a little bit about what we're doing, we're currently trying to write up this one project that we did where we paired a BHC with a medical provider, and we saw every single patient that the medical provider saw for the entire week. So in 4 days, I saw 60 patients with the medical provider, and we collected some qualitative stuff, just how the MAs and the medical providers liked it, and we also got some patient kind of information as well from it. So again, I think it would be useful just to have time if people are doing any projects to talk, and then also talk about future projects that people might collaborate on. Okay.
This is Suzanne, and I second all of that. I think
Great.
It would be great to have topics, presentations, maybe if people are going to be doing a presentation and they'd want to just try it out on us or have done one that was successful. I think it would be great to hear about it.
Okay. What else?
This is Randy. I agree with the above.
Other thoughts? Okay. So that all makes perfect sense to me. We'll discuss that in our next leadership meeting. And I think at the very least, we can certainly start off by making sure that we have a placeholder, and we can also talk with the CFHA Research Committee to see if we can have them kind of come to us with what's new that they're doing, and leave room to add other things to that, whether they're standing pieces under that research, and then to have you all sort of we'll kind of shape that as we go over the next meeting or two. So I think that's a good idea, and we'll make it happen.
Just one final little brief comment on the structure. That little précis that was just given, could generate 15, 20 minutes of conversation, and it could be that every X meetings. Not necessarily every month, but every other month or whatever. It might be good to have just a 5 to 6 minute encapsulated presentation of what somebody did, and then have sort of 15 minutes of discussion about very confined, because that was just I've already got 6 ideas from what I just heard that I would potentially want to email. I forget who it was who just gave that. Was it Dr. Bauman? Yeah.
Yeah,
David,
yeah.
Who just and so I might leave the call with like an email follow-up that might lead to collaboration right there. You know what I mean? Kind of stuff. So I think those little sort of compact things would be highly interesting and would be a real take-home from the SIG calls.
Yeah. Other thoughts? Other people agree with that? Can I get a yes?
Yes.
Yes. Okay.
Maybe.
All right. Anything else? Are there any other things you would like to see us, or any other topics you'd like to see us address, either at each meeting or at kind of every other meeting or quarterly?
This is Naftali. Can you guys hear me?
I can hear you.
All right. Hi, everybody. I don't know exactly, this is maybe more talking out loud, so I'm not exactly sure how to verbalize this, but I do think that perhaps as we work on each of our, the toolkits or the frequent asked questions and such, if there was some awareness of an ability to compare and contrast the BHC model with other models. I think that would be a helpful component of what we do. So essentially, we want to be able to communicate clearly the outlines of the model and what it's like, but we also want to communicate contrast to other models, and say SBIRT, for example, or whether it's more of the say the impact models. So again, I'm not sure how we integrate that into a meeting, but certainly I think in our work, I think it's important for us to be conscious and aware that our audience is going to be asking that question, well, how does this compare to X, Y, or Z?
Right. Yeah, I think, that's, while we certainly have an emerging scientific base on the PCBH model, I think the challenge is that it's more difficult to do the stronger scientific research pieces unless you're looking at that PCBH model, targeting one problem and then comparing it to something like impact or SBIRT. And because we see, speaking for my own system, because we potentially see anything that walks in the door, it makes it a little bit more of a challenge. But I think it's right on target. I think you want to be able to, from a scientific perspective, be able to lay out the data that shows either you get the same results, you get worse results, or you get better results. So what's your return on investment for this problem if you're using a PCBH model?
Yeah, and I think what that calls us to do, and I, because we're spending a lot of time thinking about this right now, it calls us to sort of figure out what the process and clinical outcome variables are to measure, for instance, in depression. So if we all agree that the same variables are the key ones to measure, then it would be very easy to compare a IBHC model to a 4-impact model, because you're using the same outcome variables for measuring depression. So even though depression is only a small, or not a small, but a partial component of everything treated in the ICBH, I said it wrong before, sorry, PCBH model, that subset still has to have outcomes that we're all looking at, measuring, caring about, trying to improve. And so, sure, that would be a way to sort of measure things across models.
Mm-hmm. Other thoughts? All right, so it sounds like the research piece is going to be a very big and important one that, at least for those who have called in today, that is one that folks want to see, and we'll make that happen. I'm pretty sure Jeff would be on board with this as well. Any other parting thoughts, comments before we wrap things up today? So note under 5 business items, 5C, that our next meeting is going to be in August. So we will not be meeting in July. That's the 4th of July weekend, and we thought it was probably a bad idea to have a meeting on that Wednesday. We'd get 2 people calling in.
And neither of them would make sense.
Any last thoughts or comments by anyone? Polly, anything?
No, thank you all very much.
Ebony, anything?
No.
Robin's not on, is she?
Yeah, I'm on.
Oh, you are on.
Yep,
Anything?
I think I did everything.
All right. Okay. Thanks, everybody, and we'll talk to you again.